Hello, this is Dr. Earl with Denali Medical. To get us started, I'd like to ask you a question. Are you ready? I mean, really ready. Are you ready to find solutions? Are you ready to find root source healing? If you are, well, let's go.
So I have had a herniated disc for about 30 years. And on top of that, I started growing bone spurs in my SI joint that were pushing on the nerve. Both of those pretty much made it so there wasn't much I could do. So I was going to a pain clinic where they were giving me several epidurals of steroids during the year. Had 2 different oblations on my back. I've done acupuncture, I've done massages, physical therapy, just about anything you can do, and I was getting worse. When it got to the point where the bone spurs were actually growing into the nerve, that's when I couldn't do anything. I couldn't even get up out of bed without having severe shocks. My life pretty much came to a halt for about 2 years. I was actually researching surgeons at the time. I came up here and did the evaluation, and he's like, "No, I think I can help you. I think you totally, we can treat you." And he did. He said it was a slow healer because it took several injections before I started alleviating the pain. But when you consider that I was 12 years old with my first injury and I'm 47, that's 35 years of back pain. I don't think that 4 months is a slow healing process. I think that's really fast, and it did great. Best thing about the shots, I do not have the shooting pain down my legs anymore. I do grounds work. I volunteer as a grounds work at Pace and Temple. I bent over for 3 hours at a time and no problems. I can do just about anything. I swim 2 or 3 times a week, where before I wouldn't have ever been able to do that. My family and I went and certified scuba diving. Can you believe I can lift a tank? I can walk now. I can ride a bike now. I can actually roll over in bed without having to wake up all the way so that I don't hurt myself. I have tried everything possible except for surgery, and none of it was working. And it is definitely, before you go to see a surgeon, do this. Just give it a chance. It really does work. I would definitely do it. I've referred lots of people in who come in and have success, and I just really appreciate the fact that he's trying to help people in ways that other doctors aren't getting you better. They're just putting a Band-Aid on it. And I can just be a person again.
When I started Denali, I was really looking for innovative therapies. Therapies that really kick-started root source healing. And what we found was using a combination of these therapies: oxygen, ozone, vitamins, minerals, something we call Renew-O2, using platelet-rich plasma and oxygen together, and then doing very powerfully, very precision-located migraine resets, we could enact really significant change. And that made such a difference in patients' lives. So we were helping migraines, neck pain, back pain, joints, any joint that moves, we can help. And with the IV work, we were helping patients recover and strengthen their immune system. Well, things grew, and we needed a team. And now we have an experienced team of providers that are trained, that are precisely trained, precision trained, to deliver these healing therapies. These therapies are alternatives to surgery, to medications, and there's nothing that we use that doesn't have incredible science behind it. We're looking to return patients to health and get them back to doing the things that they love. We're not masking things, we're not covering them up, and we're not cutting them out. We're looking for real, true healing. Briefly, if I may, a little bit about myself. So I trained in Western medicine. I became a medical doctor, loved it, practiced for 16 years in emergency medicine. And the wonderful thing about that was I was able to see medicine from the very youngest all the way to the very oldest, from pediatrics to neurosurgery. And I really enjoyed that. But I ended up, as we all do, having the challenges of life. And I got sick myself. I ended up with a fungal infection in my lungs. And after seeing doctor after doctor, I understand medical science has difficulty diagnosing fungal infections. There weren't any answers. So fortunately for me, I was able to keep looking, and I was able to find true root source healing and also root diagnostics that really found what was going on and started me down the path of healing. Well, when you know better, you do better. I love that phrase. And I knew better. I knew there was a better way to help patients heal. I knew there was a better way to treat myself. I knew there was a better way to deliver healthcare to patients. And so I followed it. And that is what started Denali. And yes, I'm a regular guy with a messed up sense of humor, just like everyone else. But I've got my serious side, and I'm passionate about helping patients, helping them get better, and really getting to the root source of what's causing the problem. I'm often asked, why am I still in pain? Or isn't pain a natural part of life? And the reality is, pain is a part of life, but it's not something we are supposed to endure forever. It's not something that just needs to stick around forever. We've been given powerful tools to overcome pain and heal the pain, overcome the pain. Listen to those words. Those are powerful. I remember when I was so sick, hurting from head to toe, and my joints just aching and everything being in complete disarray. And the reality is I got to the point that if this is what the rest of my life was like, it was going to be quite miserable. And it wasn't going to be a lot of fun. And I looked at all the options and fortunately was able to find some real answers and real solutions. And that's what we have at Denali. Answers and solutions. Answers that kickstart the miracle, which is the body, and gets to root source healing. If you're ready, we're ready to help. Pain is the physical suffering or discomfort that's caused by illness or injury. And there's a lot of different sources of pain. But the reality is we usually describe pain in two ways. Either acute pain, and that typically lasts about 6 to 8 weeks. That's pain that when you sprain an ankle, you twist a knee or something of that nature, the body recovers and gets things back to normal. That's the way we experienced it when we were young. Gosh, I remember doing some absolutely crazy things when I was young. Jumping off rooftops and out of trees, and my goodness, and within 6 to 8 weeks, away I went. Well, where did the information go that put me back together then? Why can I not heal now? The reality is the body's a miracle. We just need to get it back to doing what it's supposed to do. Get all the garbage out of the way, get it what it needs, and stay out of the way. Well, if our bodies don't heal, then that leads to the second type of pain, and that's chronic pain. This is pain that lasts 2 to 3 months or longer. There's pain that lasts for years. Man, I saw a sweet patient who had pain for 40 years. 40 years. And there's no reason to hurt like that. There's just no reason. Typically, what happens is patients get injured, and if it's a minor injury, they heal and they get well and they recover. Sometimes it needs treatment. And I will say that if you pass that 8-week window, the likelihood that you're going to need some type of help in recovering is high. The body, after 8 weeks, transitions into a different type of recognition and a different type of dealing with the pain. And sometimes, if you'll get in sooner rather than later, those treatments can be few, and we can really kickstart your body's healing process. Later, you go on to recover, and you get to alleviate yourself from the painkillers and physical therapy. Again, this is Denali's pathway. Now, before we talk about much more, I want to give you an idea of what's happening with medicine. and so that you can understand what all these words mean. There's Western medicine on one side, and that is based on pharmaceuticals and surgery. And certainly there's science behind that, and it has its place. I'm not saying it doesn't. On the other end of the spectrum, clear down there to the right, is holistic medicine. And they use purely herbs, supplements, no pills, no surgery. In the middle, you can see integrative, alternative, and even foundational medicine or functional medicine. And the variations that happen with that. Well, right in the center, I like to think, is foundational medicine. We look at all the science. Now, certainly, we like natural things if they work, but the reality is we'll use what works. And we look at the root source of what's causing the pain and how to take care of it. There's nothing we do that does not have scientific backing. There are pros and cons to each type of medicine. With Western medicine, it really is amazing at emergencies, major injuries, major illness, those type of things. And the reality is maximizing our lives when we age significantly. But the reality is it comes with significant side effects. Pharmaceutical side effects alone are daunting. When you listen to the advertisements for pharmaceuticals, my goodness, I mean, the only thing they leave out is spontaneous explosion, which is no fun for anyone. But the reality is there's side effects, and so we need to be careful when we use that very powerful side of medicine. On the other side is holistic medicine, and again, this is on the extreme. They can help the body heal, but the reality is they're very slow, and it takes a while. Well, again, right in the middle, foundational medicine, and the opportunities that we have to really merge the best of both worlds. So at foundational medicine, we really seek to identify and address the root cause of disease. We see the body as an integrated system. It really isn't just divided up into individual parts. And we're not playing a matching game, this symptom with that prescriptive or pill. We want to look at the whole body of a system as a system. Now that said, at Denali, we really focus in on joint pain, headaches, back pain, neck pain, and IVs in order to help maximize your healing. To further illustrate what happens, again, their cycle is you get injured, you're prescribed medicine for pain. Medicine can cause nutrient loss. It can also cause dysfunction and healing. For example, here we're looking at ibuprofen. Ibuprofen and NSAIDs in general, so that's naproxen and the like, they actually block your body's ability to put down new collagen. Collagen is this molecule, if you will. It is the protein that your body needs to build cartilage, to rebuild bone. A lot of the structures, tendons, ligaments, are dependent upon collagen. Collagen is what gives the elasticity to some degree to our face and the other tissues in our body. That coupled with elastin. But collagen is that core structure. Well, ibuprofen actually blocks our body's ability to heal that. Ibuprofen also blocks what's called the glycocalyx. That's in our cardiovascular system and in our stomach. So it really is a medication that has significant side effects. Certainly, it helps with pain, and it blocks some degree of inflammation, but at the cost of long-term inflammation. It was never designed to be a long-term medication. So this then turns to an inability to heal. This causes prolonged or long-term inflammation, chronic pain, and the next thing you know, we need stronger pills, stronger prescriptions, different prescriptions. We're piggybacking prescriptions. It's just a never-ending cycle. At Denali, we look at what is causing the issue of the pain. We use vitamins, minerals, empowered oxygen, and we kickstart your body's natural healing process. We treat you just as long as you need, and next thing you know, you're healing and you're improving and getting better. Empowered oxygen really has an amazing history. Back in 1840, ozone, or O3, was first discovered. In 1932, a scientist found that he could combine ozone with water and use it as a disinfectant. In 1950, two German doctors developed the first ozone generator. Clear back in the 1980s, ozone therapy was first introduced in the United States. And then since then, we've coupled that with other procedures and processes to make Renew-O2. And it is combined with vitamins, minerals, and some medications to really kickstart your body's natural healing process. So we unlock the power of oxygen and the power of these minerals and really start the body healing. Renew-O2, that is a very specific precision injection. One of the things that's very different about Renew-O2 than other oxygen or ozone therapies is that we use precision placement of the nutrients. A lot of times doctors are trained to simply put the needle in so far, push hard, and that's that, and let the body do what it needs to do. But we've found that we have significant improvement in outcomes if we place the nutrients in the fascial planes. And it takes practice, and it takes skill, and it takes training to find those fascial planes. Well, because of that, we have less trauma, we have better outcomes, and the body does better at regenerating cartilage, torn muscles, tendons, relieving muscle spasm and strain, and getting joints back to full function. This slide, as far as how Renew-O2 works, is very busy. I understand that. And for someone who wants to really dive into exactly how this works, we've included this for you. Take some time, pause right here, and look at this as far as how it works. But understand, at each step you can see there is significant science behind what we do and how we treat the patients. How do we get Renew-O2 into your body? Well, again, it's a combination of oxygen and nutrients. Because Renew-O2 is more natural and easier for the body to use, and because we use precision placement, we can use smaller needles. That means less pressure. And again, we find those fascial planes where the body, these are really the natural canals of the body. They're the natural distribution centers or pathways of the body. Why not use them? Well, we do. The next question is, what does it treat? Well, sometimes it'd be better to say, what doesn't it treat? The reality is, if it moves, Renew-O2 will help your body recover. Muscles, tendons, ligaments, joints. This is every joint. Certainly we list shoulders and knees here, but we've had great success with fingers, toes, elbows, wrists, TMJ, the temporomandibular joint. Additionally, we have therapies for migraine headaches that are unique and innovative. So if it moves or if it's in pain, chances are Denali can help. Compared to surgery, we are cheaper, safer, and more effective. The reality is, even if insurance pays for a lot of your surgery, in most cases, we are less than what your copay will be. So it's something to look at as far as Denali. And we know that surgery sometimes has complications. Don't get me wrong. Surgery, when it's needed, we will send patients for surgery. And there are times when it is absolutely needed. That does not frighten us. But the reality is, you want to look at all of your options before undergoing the knife. What about stem cell? I'm often asked, gosh, where does this compare to stem cell? Well, stem cell is going to be amazing. And I have an entire video based on the science of stem cell and where it's at. The reality is it's not quite there yet. And that's why we still aren't offering it here at Denali. Now, will it come? Likely, as the science improves. But the nitty-gritty is, stem cell is around 40 to 50% effective. So it helps, it works. And we have patients that have wonderful outcomes. But the reality is they aren't breathtaking. Additionally, after you hard freeze, cryo-freeze stem cells, only 2%, now that's not my data, that's their data, 2% of those cells become active again. So if they put in 10,000 cells, you're barely getting 200 of those cells that come back active again. 200 sounds like a lot, but putting in 10,000 to get 200 seems a little ineffective. Now, most providers, when they deliver stem cell, they combine it with PRP, or platelet-rich plasma. That's because PRP has about a 60 to 70% effectiveness. Interestingly enough, stem cell plus PRP still has about a 60 to 70% effectiveness. So the reality is stem cell isn't as effective as we want it to be. It isn't as effective as the hype. And we can see that its effectiveness is here. The data shows that PRP is between 70 and 80% effective. If you combine PRP with O2, then you get higher results. And then renew O2 as far as its results and what we expect to see patients receive and the rate we expect them to heal. One of the other treatment options that you may see out there is cortisone. Cortisone is interesting, and we have a lot of patients that say, wow, that really helped. Well, what it's doing is it's turning off the inflammation that's causing pain and soreness. And initially you might think, gosh, that's great. But the reality is it has its set of side effects. Cortisone causes death and or degeneration of nearby bone, thinning, and even osteonecrosis of bone. It has a reasonable occurrence of joint infection. It's been shown to cause some nerve damage. In general, it just does things to our body that we don't like. Let me put this simply. Our bodies are either healing and building or they're breaking down. And there is a constant cycle. There should be this up and down of each of those. When something's broken down, then comes in the back door the healing process. Well, in a chronic scenario, that doesn't happen. Cortisone exaggerates the breaking down process. Renew-O2 and PRPO2 exaggerates the healing process. This is a chart that we have put together that looks at a lot of different treatment options. Renew-O2, PRPO2, Prolozone, PRP alone, prolotherapy, hyaluronic acid, placebo, umbilical cord, mesenchymal stem cell, something called autologous stem cells, amniotic fluid stem cells, placental stem cells, cortisone, and surgery. And they are ranked in their effectiveness and their cost. The reason why stem cell ranks so low is because it's horribly expensive. There's actually going to be some further discussion on this chart with a further webinar. But if you'll look, Renew-O2 and PRPO2 really are at the pinnacle. They are the best therapies that science has to offer. The next question you may have is, how long is this going to take? What's all involved? Well, with most patients, you're looking at anywhere from a 3 to a 6 month healing process. Now, I have had patients that have had previous surgeries or had significant bulging discs and really had some bad pathology, bad illness, bad injuries, and they have required longer than that. But most patients will see rapid results in a 3 to 6 month period. How does that compare? Well, it compares, let's look at surgery. Many surgeries, you're 9 months before you're really back to doing a lot of your regular function. And you have weeks of recovery and isolation. With Renew-O2 and PRPO2, for the most part, you go back to your normal activities. So what we find is patients do better if they will get a 3 or 6 month package. What this does is it allows them to get the number of injections that they need to really recover and do what they need to do as far as visits to the clinic. Then you're not worried about, bills and this and that. It's paid for, it's done, you come in, you focus on getting well. It really is the best mind-body-spirit combination, mind-body-energy combination as far as getting you well. And we'll talk more about packages during your visit. This chart really shows what we're looking at from a healing standpoint, and you can see our numbers here. And our silver package and gold packages really are our best treatments as far as getting you well. The nice thing about Denali is we've helped thousands of patients. So you don't just need to take my word for it. We have amazing testimonials that will help you understand the power of Denali.
My name's Chris Lovelace. Got in an accident, vehicle accident, a couple months ago. Sustained some injuries that were, in my mind, devastating. Some lower back injuries, Got an MRI done. Dr. Earl looked at it. Had my L3, L4, L4, L5, L5S1. The discs were essentially dead. Inflammation basically all around them. That just killed them. So couldn't walk, couldn't do any of my daily activities, CrossFit, work. Being a competitive CrossFitter, and overall just an active person in life, being back on my feet as quick as possible was important to me. Started getting some injections from Dr. Earl, and 5 weeks later, here I am, essentially walking, running, CrossFitting again, being able to squat, which I couldn't do, heavy squats, and essentially just living life the way I feel like I'm meant to live it. Honest, professional, feeling for a good deal. They got that too. Just quality in their work. They're not covering up a problem; they're actually solving it. So I wouldn't recommend anybody but these guys. For me personally, it's onward and upward from here.
Okay, here we come, full circle. At the beginning of this lecture, I asked you, are you ready? Are you ready? And we're going to close with that same question. Are you ready? If you are, let's go. Get more information and/or contact us with the information below. We look forward to seeing you soon. Thanks.